Hey, I'm Dr. Ed. Today we're going to be going over foam rolling. As you can see, I've got a foam roll here. This is a black styrofoam. This would be considered more firm. They do have a blue one that is more made out of like what you would see in a pool noodle. Seems to be tends to be softer. So I recommend this one, although it can be a little uncomfortable to start with. You'll probably end up liking this better in the long run, having this one instead of investing in 2 foam rolls. So they also make this in different sizes. There's a travel size that's about 1/3 of this. There's about half the size, and they make the longer ones like this. Today we'll use the long one. So we see a lot of practice members coming in with tight lower back muscles, achy, sore, or in the buttock as well. Sometimes these muscles can get so tight it presses on the sciatic nerve, which is in the butt, and actually can cause sciatic pain, which is pain that radiates down the leg, or a numbness, and it's simply from tight muscles. So lactic acid buildup causes sore muscles. When a muscle is continually contracted and stays tight, it builds up lactic acid and becomes very sore. So we see these imbalances in these muscles, and the reason why we would like you to do these foam roll exercises or stretches is because it helps. Think of a rolling pin when you're rolling out dough. This is pretty much the same premise, is that you're going to get in and you're going to knead these muscles and push a lot of that lactic acid and these muscle adhesions and tightness that occurs in a chronically contracted muscle. This is going to help support your chiropractic adjustment and alignment, in other words, and it's going to help keep balance or even tone in your lower back musculature and buttock region. So we're going to start with just putting this down on the ground like this, and I'm going to start in the buttock area, and we're going to sit right on it. Now, at first you may feel a little uneasy on the foam roll, a little instability, in other words. You want to take your hand and open it up like this, and you want to place it behind you, maybe about 1.5 feet, 16 inches or so behind you, and that will give you a stability, just rolling just like this. We're going to straighten this leg out. We're actually going to take and cross this leg over like this. So if you notice, I'm making a figure 4. I'm going to grab the ankle here, okay? Now I'm more leaning on the left. I'm on the left side, the left buttock. So I want you to remember that you are crossing the leg in this figure 4 pattern. That's the side that you're predominantly leaning in on in the buttock region, all right? A lot of people will tend to do this, and they roll, and they're like, I really don't feel a lot. And that's because you're doing it the wrong way. You want to bring that leg up in that figure 4 position. You're leaning on this left side as you're doing this. The more that you bend the other leg up, in this case the right leg, the more intense the pressure is going to be into the buttock region. So I'm going to start with it leg straight, and I'm just going to roll around. Again, I've got my hand spaced apart, almost like a tripod, if you will, for stability, and my arms straight. You just have to be careful. You want to bend at the elbow if you do have shoulder issues a little bit, to take some stress off the shoulder. And you're just going to roll around, and you're going to roll to the sit bone, which is called the ischial-tuberosity, and then you're going to come all the way to the belt line just about. And then you're going to come inward towards the sacral base there, and then outward a bit as well. And you're going to feel those tender points in there when you hit them, those adhesions, trigger points, if you will. Often the muscle involved here is the glute medius, minimus, I should say, and the piriformis muscle, very tight. So you're going to roll, and you're going to feel that pressure point. Sometimes you can actually even produce the pain down the leg as a result of loosening this muscle. You're not doing damage when you do that. It's just super, super tight. Again, a lot of lactic acid buildup, and it's going to take a while. It's going to be uncomfortable for the first couple of weeks that you do this. So you're just going to roll around. As you can see, I've probably done it about 30 seconds. That's about how long you want to do it. Not really a count as far as repetitions here, just more like 20 to 30 seconds. When I go to the other side, again, you'll develop coordination to move around on this foam roll. Again, hand's going to be open. I'm bringing it back about 1.5 feet for stability. I'm going to cross here as the figure 4. Now I'm leaning on the right side of my buttock there, and I'm going to bend this knee up on this one just a little bit, and that's going to create more intensity. So again, if the leg is straight, the opposite leg is straight, less intensity, more intensity. And I'm going to roll around till I find those tender points. And again, we're just kneading the muscle, getting it to loosen up, getting some of that lactic acid buildup out of the muscle as well. And again, don't be afraid if you feel a little bit of radiation down the leg, as this because you're on the sciatic nerve when you do this. Okay, and we'll do that for about 20 to 30 seconds. Once you're done with that, you can kind of just slide off the foam roll, and you're gonna start in your lower back, and your knees are gonna be bent up. This is actually good for core as well. One thing I wanna make sure, I'm gonna talk to the camera, but your head should be in line with your shoulders when you foam roll. Meaning you shouldn't have it up like this. So you wanna drop it back about like this, okay? And we're gonna roll to the lower back and up to the mid back, almost between the shoulder blades. If you go too high, it's gonna slide potentially. If you're on a yoga mat, the styrofoam tends to grip the rubber of the mat, so it'll stay in place. But if you're on carpet, typically it'll slide off. So you'll just go up and down a good 5 to 10 times, and you may feel your spine release, cavitate, in other words. You'll hear a popping sound. That's just gas being released in the joints. You're not throwing anything out. When you get to the lower back, you're not gonna feel a lot. It's kind of gonna be right on the spine there. In fact, it can feel a little uncomfortable. So what you wanna do is, in order to get those muscles in the side of the spine, as you stay upward, again, remember your head should be straight this entire time here, as opposed to here. So you wanna drop both knees off to the side. And you've got about a 6-inch window there to get into the lower back, what we call the quadratus lumborum muscle, okay? And you'll do that for about 20 seconds. And then you'll go to the other side where your knees, again, drop down. I'm gonna drop my head, and you're gonna come here. And you can bring your arms here, you can bring them here. Okay, now if you cannot hold yourself up like this, you find yourself shaking, your core is pretty weak, you can put the elbow on the floor like this, provided you don't have shoulder issues. And if you do, please let us know. We'll help you with that to modify it. But this will take a little bit of stress off of your midsection there if you don't have the strength to hold yourself up. And you would just roll like this. The key is with this foam roll here, when you're in the lower back, is that you want to keep everything above the belt line looking upward, straight upward, and just drop the knees to the side. So literally, I'm going to demonstrate how I do it. Just like this. And I'll go back and forth 5 to 10 seconds for a couple of times. Two times would be fine, each side, just like that. And then again, rolling the mid back all the way down and up. A couple more times. And that concludes foam rolling for the lower back.